Hello everyone and welcome back to my pathology playlist. Chapter 15 कर रहे हैं मीडियम रॉबिन से, which is about oral cavities and GI tract pathology. So ये इस chapter का पूरा detailed schedule है जिसमें हम जो different videos बनाएंगे. Today's video is going to be on oral cavity disorders और फिर हम बात करेंगे next video में esophagus है, stomach, intestine और इस तरह से we will proceed with the chapter. Today's video is going to be on the oral cavity. Okay, so the GI tract is a hollow tube consisting of esophagus, stomach, small intestine, colon, and rectum. You know this, and it ends at the anus. So each region has unique, complementary, and highly integrated functions that together serve to regulate the intake, processing, absorption of the ingested food. So the whole tube is designed और हर जगह का पार्ट का काम अलग अलग है. सो ओरल कैविटी हैज इट्स ओन डेजिग्नेटेड फंक्शन. फिर एसोफेगस है, उसका काम सिंपल ट्रांसफर ऑफ फूड है फ्रॉम द ओरल कैविटी टू द स्टमक. आई थिंक अगर आप मुझसे पूछें तो एसोफेगस इज द ट्यूब जिसमें सबसे कम फूड प्रोसेसिंग होती है. देयर इज मोर सॉर्ट ऑफ ओनली ट्रांसफर ऑफ फूड, नो प्रोसेसिंग. फिर बाकी तमाम जगहों पर बहुत सारी प्रोसेसिंग है. सो दिस चैप्टर विल डील विद एवरी पार्ट ऑफ द जीआई ट्रैक्ट और उससे एसोसिएटेड पैथोलॉजी. सो ओरल कैविटी आज का टॉपिक है. Pathology conditions of the oral cavity can be broadly divided into diseases affecting teeth, because this is what you have in your oral cavity. Their support structures, teeth के जो supporting structures हैं, oral mucosa. Let me tell you that oral mucosa is highly vulnerable to various diseases. उसका reason ये है कि सोचे ना, आपका जो oral mucosa है, it is the first thing to be exposed to whatever you eat. आप गर्म चीज खा रहे हैं, ठंडी चीज खा रहे हैं, मसाले वाली चीज खा रहे हैं, टॉक्सिक चीज खा रहे हैं, I mean whatever you are eating, oral cavity is the first thing जिसका जो mucosa है, it is exposed. So I mean it is understandably one of the most common sites of disorders in the GI tract. फिर salivary glands भी oral cavity में आते हैं and the jaws. Discuss next are more common conditions affecting these sites. Odontogenic cysts and tumors, benign and malignant, which are derived from the epithelial and or the mesenchymal tissues associated with tooth development, are also discussed briefly. So we will basically talk about कि oral cavity में जो structures हैं उनमें क्या क्या issues होते हैं. ठीक है. So diseases of the teeth and the supporting structure. Caries. Dental caries is a very common disorder. Dental caries result from focal demineralization of tooth structure, particularly the enamel और उसका dentin, caused by acids generated during the fermentation of sugars by the bacteria. So इसीलिए कहते हैं ना कि हर वक्त दांत क्लीन रखें, वरना जो टीथ का स्ट्रक्चर है उसमें there is focal areas of demineralization. Enamel जो है किसी जगह से क्रैक हो गया, टूट गया, this is known as carie. हो सकता है आपके भी टीथ में से कोई टीथ affected हो by the dental carie. Worldwide, caries is the main cause of tooth loss before the age of 35. The prevalence of caries used to be very high in the developed countries where there is ready access to processed and refined foods. So processed food and refined foods जो डब्बों में मिलता है या इस तरह की जो organic चीजें नहीं है, they have a lot of sugar content and therefore there are chances for bacteria to get them fermented and then the acidic environment is generated. Also the drinks, the cola drinks, However, the rate of caries has dropped markedly in the countries such as in the US, where oral hygiene has improved and fluoridation of the drinking water. So, fluoride is an important constituent to prevent the process of caries. इसलिए कहते हैं कि fluoride वाले toothpaste use करने चाहिए. Also, in the drinking water to certain extent helps. Fluoride is incorporated into crystalline structure of the enamel, forming fluoroapatite, which is resistant to degradation by the bacterial acids. So this is what has happened in the US. They have started drinking fluoride in water, and now their dental, enamel is much more resistant to the bacterial damage. In contrast with the globalization of the world's economy, processed foods are being increasingly consumed everywhere, also in the developing countries like Pakistan, India, Bangladesh, और उसकी वजह से dental caries का risk बहुत ज़्यादा बढ़ रहा है. I mean more carbohydrate basically, so more fermentation and more chances of dental carie. Gingivitis, itis is always the inflammation, and this is the inflammation of the gums. Inflammation involving the squamous mucosa or the gingiva जिसमें दांत फिक्स होता है. So you have the gum जिसके अंदर आपका टीथ फिक्स होता है और क्राउन आप उसका ये इनेमल देख रहे होते हैं और फिर नीचे डीप एरिया जो होता है that's within the gum. इसकी inflammation is usually caused by poor oral hygiene which facilitates buildup of dental plaque and calculus. तो दांतों पे plaque बन जाता है, calculus बनता है, bacteria deposit होते हैं, they start forming biofilms, जिसकी वजह से dental caries भी damage होता है, and the whole gum becomes inflamed. So that sort of thing. The bottom line and the underlying scenario is the poor oral hygiene. But I would also like to tell you that there are some systemic conditions जिसमें भी ये gingivitis बड़ा common है. One of the very common one is diabetes mellitus, for example. Okay, that leads to gingivitis very commonly. Periodontitis is an inflammatory process that affects the supporting structure of the teeth, the periodontal ligament. So दांतों के support के लिए ये ligaments मौजूद होते हैं, and if they get inflamed, this is the periodontitis. Again, a common disorder. Or alveolar bone or cementum. In सबकी inflammation comes under the domain of periodontitis. With progression, periodontitis may result in destruction of periodontal ligament and alveolar bone and eventually teeth loss. देखें, ये जो दांत है ना, ये बड़ा tightly fixed है आपके socket के अंदर, gum के अंदर with some ligaments. अगर वो inflamed हैं और ये gum की cavity disturbed है, तो ये ज़ाहिर tooth अपने socket में lose हो जाएगा and ultimately it can shed off, गिर सकता है. Periodontitis is associated with poor oral hygiene. आप देख रहे हैं कि ज़्यादातर ये जो अभी हम disorders पढ़ रहे हैं, they are all associated with poor oral hygiene. Facultative gram-positive organisms are found at the healthy sites, while anaerobic and microaerophilic gram-negative bacteria can colonize the plaque if there is poor oral hygiene. Although about 300 bacterial species reside within the oral cavity, it sounds like the oral cavity is a house to a lot of bacteria. 300 different species. Periodontitis is most commonly associated with Aggregatibacter, Actinobacillus, Actinomycetium comitans. मुश्किल नाम है, बहरहाल याद रखने हैं आपको यार, क्या करें, है ना? अच्छा जी, फिर ये तो I mean that simple stuff. हल्का सा इन्होंने टच किया है कि dental caries क्या है, gingivitis क्या है, and periodontitis क्या चीज है, right? Now the oral inflammatory lesions. The first one is the Itis ulcers, also known as the canker sore. These common superficial mucosal ulcerations affect up to 40% of the population. So at one point of your life, you may also have these ulcers in your mouth somewhere. They are more frequent in the first 2 decades of life, extremely painful. कभी इस तरह का आपको छाला निकला मुंह में, जिसको आम ज़बान में हम कहते हैं. You know, there is loss of mucosal covering and that yellowish छाला type of cheese. very painful. इसकी beauty और इसकी जो identification feature है वो यही है. Beauty तो खैर नहीं कहना चाहिए, it's very painful. और ये बार भी होता है. Although the cause of Itis ulcer is actually unknown, they tend to be familial and may be associated with celiac disease, inflammatory bowel disease, Behçet disease. But let me tell you, in many of the cases, ये associated diseases नहीं होती, and the Itis ulcer is there as a solitary finding. Ulcers can be solitary or multiple. Typically, they are shallow with hyperemic base covered with thin exudate. जो yellow दिख रहा होता है, that's because of this thin exudate, and rimmed by a narrow zone of erythema. So इस तरह से एक ulcer होगा और आसपास यहाँ reddish होगा because there is erythema, there is inflammation. In most cases, they resolve themselves within 10 days, but they can recur. Or treatment इसका such कोई है नहीं. You just use gels like Somo gel type of thing to soothe them. Otherwise, they resolve themselves. Self-limiting होते हैं. Then HSV infections, herpes simplex virus infections, they also cause self-limiting primary infection that can be reactivated when there is compromise in the host resistance. Most orofacial herpetic infections are caused by HSV1. There are different subspecies. For example, genital herpes hai, that's a different species that is by the herpes virus 2, HSV2. That's genital herpes. Oral herpes, HSV1. With changing sexual practices, oral HSV2 is becoming increasingly common. Actually, here they are talking about oral sex. So they have not written it open. मैं आपको बता देता हूँ oral sex. So because of oral sex, what people are doing is transmitting and contaminating the genital stuff at their oral cavities, and that's what it is. कि oral HSV2 infection. Suppose a lady or a male with HSV2 infection affecting their genitals, having oral sex, and now this is transmitted to the oral cavity of the person doing the oral sex. That sort of thing. Okay. So HSV2 is also now being seen increasingly in the oral cavity. Primary infections occur in children between the ages of 2 to 4, and they are often asymptomatic. However, in 10 to 20% of the cases, primary infection manifests as acute herpetic gingivo-stomatitis. यानी gingiva में inflammation है और मुंह में stomatitis is the oral inflammation with abrupt onset of vesicles, ulcerations throughout the oral cavity. So if you see solitary ulcers like this, that is usually aphthous ulcers. If you see, throughout oral cavity there is inflammation, there is more chances that this is HSV infection. Most adults harbor latent HSV, यानी उनको वायरस होता है, एक्टिवेटेड नहीं होता बॉडी में, and the virus can be reactivated anytime, resulting in the so-called cold sore or recurrent herpetic stomatitis. यानी उनमें वायरस का इन्फेक्शन था, but at the time that was inactivated and get reactivated again, and this is now called the cold sore or the recurrent. नाम से ही जाहिर है ना, recurrent दोबारा हुआ. Now factors associated with herpes simplex virus reactivation include trauma, stress, allergy, ultraviolet radiation ka exposure, upper respiratory tract infection, pregnancy, any sort of immunosuppression such as HIV or the use of steroids. All these things lead to, even menstruation, they lead to reactivation of HSV. Recurrent lesions which occur at the site of primary inoculation or in adjacent mucosa innervated by the same ganglion. Herpes simplex virus का जो infection है, that is at the ganglion, neuronal affect करता है ये. Typically appear as a small group 1 to 3 millimeter vesicles. The lips, herpes labialis, nasal orifice, buccal mucosa, gingiva and hard palate are most common locations जहाँ पे वो actually ये भी blisters और छालों की तरह नजर आता है along the division line of the nerves. तो ये basically skin पर at these areas, skin of the lip, orifice, buccal mucosa, यहाँ पे group of blisters आपको नजर आते हैं herpes infection के. Although lesions typically resolve 7 to 10 days में, ये भी self-limiting है. They can persist in immunocompromised patient who may require systemic antiviral therapy. That is rare कि किसी का इतना infection हो कि उसको fever भी हो रहा है और pain भी हो रहा है और the person has to have antiviral therapy. Usually 7 से 10 दिन में self-limiting. Morphologically, the lesions resemble those seen in the esophageal herpes. And later in this chapter, we will discuss about esophageal herpes and genital herpes. The infected cells become ballooned and they have large eosinophilic internuclear inclusion on histopathology. Adjacent cells commonly fuse to form large multinucleated polykaryons. Okay, so ये बड़े-बड़े इस तरह के polykaryon structures बन जाते हैं. We will talk about when we see the esophageal herpes as well. So herpes simplex का infection, we talked about aphthous ulcers. Aphthous ulcers का कोई inflammatory etiology तो है कि there is inflammation, कोई infectious etiology अभी तक known नहीं है कि कौन सा infection करता है. But obviously herpes simplex virus is a infectious etiology. Then another infectious etiology stuff is oral thrush. Candida ka growth in the oral cavity. Candidiasis is the most common fungal infection of the oral cavity. Candida, this is an important line to study, okay? It is the most common fungal infection of the oral cavity. Candida albicans is a normal component of the oral fluid. It's normally there in your oral cavity. And the predisposing factors include the following: immunosuppression. And immunosuppression के scenarios क्या क्या हो सकते हैं? Somebody on HIV, somebody on steroids, somebody during pregnancy. These are all the conditions when their immune system is suppressed. And the composition of the oral microbial flora, microbiota depend करता है कि आपका oral hygiene कैसा है. If there are some species more than the other, Candida albicans can overgrow, that sort of thing. Now, broad spectrum antibiotics that alter the normal microbiota can promote oral. This is an important point. नेचर ने आपका सिस्टम ऐसे रखा है कि आपके जीआई ट्रैक में भी, ओरल कैविटी में भी देयर आर डिफरेंट बैक्टीरिया, डिफरेंट फंजाई और उनका एक बैलेंस होता है. एक पर्टिकुलर बैक्टीरिया दूसरे को सप्रेस कर रहा होता है, बाजू का एक पर्टिकुलर बैक्टीरिया दूसरे को प्रमोट कर रहा होता है उसकी ग्रोथ को, दैट सॉर्ट ऑफ थिंग. सो अगर हम एंटीबायोटिक्स यूज करते हैं, से फॉर एग्जांपल इफ समबडी इज यूजिंग ऑगमेंटिन एंड दैट आल्सो एट अ वेरी हाई डोज ऑफ 1 gram BD, so that's a considerable dose. So it will inhibit a lot of bacteria, including the normal flora of your body. तो आपकी GI tract और आपके oral cavity का जो normal flora है, that will be disturbed. And in certain cases, what happens कि इस disturbance की वजह से candida grow करता है, and the person starts getting oral candidiasis. Okay. Now the pseudomembranous और उसकी वजह से एक ऐसे membrane type white color का structure बनता है, which is what we call the pseudomembranous thrush. Also known as the thrush simply. This condition is characterized by a superficial curd-like, dahi ki tarah, gray to white inflammatory membrane composed of mated organisms enmeshed in the fibrinosuperous exudate. So ये पूरा inflammatory system आपको इस तरह का. So I think this is a diagram. It's not actually the diagram from oral candidiasis, but इसी तरह के आपको white plaques मिलते हैं. ये तो leukoplakia की diagram है. But oral, you see, open the mouth and you see like ऐसे white patches आपको नजर आएंगे, which is basically dead bacteria with suppuration, exudate, fibrinosuppur. यानी जो inflammatory reaction वहाँ हुआ है, उससे जो भी exudate बना है, that appears like grayish to white. In mildly immunocompromised or debilitated individuals such as diabetics, the infection usually remains superficial, but something serious can happen if the person is severely immunosuppressed, and in such cases, there can be systemic involvement, okay, and that can be something serious. So, if candida spreads systematically, so oral cavity की ये सारी disease important. Just open the mouth, you see the ulcer, indicative of something. You see inflammation in the gingiva, poor oral hygiene. You may see herpes simplex infections, similar stuff. तब बनेंगे ये सारी diseases जब poor oral hygiene है या कोई oral cavity का infection है. So all these are oral inflammatory conditions. Okay. Now a very important topic is the proliferative. And then we have to talk about the neoplastic lesions of the oral cavity. Proliferative lesion का मतलब ये है कि there is growth of cells. The cells are multiplying and growing in number. And obviously, if the cell's genome alter, then we are talking about the neoplastic lesions. So proliferative lesions, fibromas are submucosal, nodular, fibrous tissue masses that are formed when chronic irritation results in reactive connective tissue hyperplasia. So, because of any reason, if there is chronic irritation, fibromas may develop. They occur most often on the buccal mucosa along the bite line. जहां से आप चबा रहे हैं, तो बार बार अगर से फॉर एग्जांपल आप कोई चबा रहे हैं खाना और बार बार आपके टीथ और जो सराउंडिंग स्ट्रक्चर सॉफ्ट टिश्यू का है उसमें कोई रगड़ है, कोई फ्रिक्शन है, दैट कैन लीड टू फाइब्रोमा. क्रॉनिक इरिटेशन, फाइब्रोमा फॉर्मेशन. ट्रीटमेंट इज द सर्जिकल एक्सिशन एंड दैट्स व्हाट इट इज. और जो भी इरिटेट कर रहा था उस सोर्स को आप निकाल दें. सो लेट मी सी इफ देयर इज अ फाइब्रोमा. सो यू सी हियर that is a big proliferation. That's the fibroma. Okay, bite line. So ये दांत है, bite line पे है ये, and the treatment is surgical removal. Then the pyogenic, word pyogenic means यहाँ पे पस का कोई सिलसिला होगा. Pyogenic granuloma. It is also an inflammatory lesion typically found in the gingiva of children, young adults, and pregnant women. It's also called the pregnancy tumor, pyogenic granuloma. Okay, it's also called the pregnancy tumor. You see here, this is the pyogenic gingiva से ये connected होगा, दांतों के बीच में ऐसे निकल रहा होगा, pyogenic granuloma. These lesions are richly vascular. You can see how red it is appearing. They are richly vascular and typically ulcerated, which gives them a red to pulpy color. और बड़ा देखने में बुरा लगता है, bleeding type का लगता है. In some cases, growth can be rapid and raise fear of malignant neoplasm. Whenever something looks, एक growth है and it's looking bad, which means कि bleeding हो रही है, ulceration हो रही है, बड़ा सा है size में, reddish color का है. So many people think it is malignant. It is actually not. Histologic examination demonstrate proliferation of immature vessels similar to seen in the granulation tissue. Granulation tissue is basically the healing tissue. जब healing होती है किसी wound के बाद, उस तरह का इसका histopathological profile है. Pyogenic granulomas may regress, mature into dense fibrous masses, or develop into peripheral ossifying fibroma. And surgical excision obviously is the definitive treatment. Okay. Then very important and I would say very common conditions known as leukoplakia and erythroplakia. Very important. Okay. नाउ बिकॉज ये कॉमन है, चूंकि कॉमन बहुत ज्यादा है इसलिए इसका जिक्र बहुत ज्यादा होता है. नाउ leukoplakia is defined by the WHO as a white patch or plaque that cannot be scraped off and cannot be characterized clinically or pathologically as any other disease. So such white plaques. बंदे को बोले मुंह खोले, इसको आप किसी स्वैप से स्क्रैप करने की आराम से कोशिश करें. It doesn't come off, so this is not an exudate, this is not candida. It is fixed within the mucosal line of the oral cavity. Then you diagnose this as leukoplakia, the white patch which cannot be scraped off. This description is reserved for the lesion that arises in the oral cavity in the absence of any known cause. यानी अगर कोई known cause है तो फिर आप इसको लेबल नहीं करेंगे as leukoplakia. Accordingly, white patches caused by obvious irritation or entities such as lichen planus, candida are not considered leukoplakia because they have a defined cause. यानी अगर आप इसको कल्चर कर रहे हैं and you are making a diagnosis of candidiasis, then this will not be labeled as leukoplakia. For leukoplakia to be labeled, it has to be an undiagnosed type of thing. यानी आपकी कोई diagnosis नहीं बन रही. Okay? Approximately 3% of the world's population has leukoplakia, of which 5% to 25% are dysplastic. And they are at risk of progression to squamous cell carcinoma. That's an important point. They are at risk of, so you can probably call them pre-neoplastic condition. They are at risk of progressing to a cancer. Thus, until proved otherwise by means of histologic evaluation, all leukoplakias must be considered precancerous. यहाँ मैं इसको रेड लाइन मार देता हूँ. तो जब कभी आप ये मुंह में व्हाइट कलर की चीज देखेंगे ना, you have to worry about, because they are all considered precancerous until proven otherwise. That sort of thing. Okay. Related but less commonly seen entity is the erythroplakia. Erythro is for red, so that's a red velvety appearance on the mucosal lining. Erythroplakia is associated with much greater risk of malignant malformation. तो इसको भी मैं red mark करूँगा. It's much greater risk. So if you see that red thing in the oral cavity, that has a much greater risk of malignant transformation considered compared to the leukoplakia. So while leukoplakia and erythroplakia may be seen in adults in any age, they typically affect the individuals in this age. 40 to 70 males में ज़्यादा common है, 2:1, यानी 2:1 male to female ratio. Although the etiology is multifactorial, tobacco use हो सकता है in different forms, tobacco, smoke tobacco, chewing tobacco, exact etiology is not known basically. But importance in दोनों terminologies की ये है कि they are precancerous. Okay, so whenever you see them, you have to worry about them. So precancerous, right? Then we are jumping now to the squamous cell carcinoma of the oral cavity. Now oral cancer जो है ना, ये हमारे part of the world में तो it is the number 1 cancer in males and number 2 in the females. Females में number 1 breast है और breast के बाद number 2 oral cavity है, जबकि males में तो it is number 1 cause in males. Okay, so males में is the first common cancer, female में is the second common cancer. उसका reason ये है क्योंकि in our part of the world usually we have a lot of different forms of tobacco consumption, particularly मतलब टोबैको की एक फॉर्म तो ये है कि आप सिगरेट पी रहे हैं, बट देयर इज ऑल्सो, ओ माय गॉड, लाइक यू नो अबाउट द पान, यू नो अबाउट द गुटका थिंग, you know about the I don't know what they call it, mawa or something, where they have like hell different types of chemicals, और वो हमारी कंट्रीज में बहुत ज़्यादा कॉमनली यूज़ किया जाता है. सो इसीलिए ओरल कैंसर हमारी कंट्रीज में तो हद से ज़्यादा कॉमन है. ठीक है, वेस्ट में इतना कॉमन नहीं है, बट एशियन कंट्रीज जिसमें इंडिया, पाकिस्तान, बांग्लादेश, इधर बहुत कॉमन है ओरल कैंसर. Approximately 95% of the cancers of the oral cavity are squamous cell carcinoma. That's their histological type, with the remainder largely consisting of adenocarcinomas of the salivary gland. The most common category is the squamous cell carcinoma, जिसको हम बोलते हैं OSCC, oral squamous cell carcinoma. ठीक है, squamous carcinoma is a very aggressive epithelial malignancy. It's the 6th commonest in the world today. Actually, it is no more 6th. लेटेस्ट अगर आपको स्टैट्स देखने, यू शुड विजिट द ग्लोबोकैन वेबसाइट, ग्लोबोकैन 2022 रिसेंटली. ऑल्दो मेरा एक लेक्चर है कैंसर एपिडेमियोलॉजी पे, तो उसको पढ़ें तो आपको रिसेंट स्टैट्स पता लगेंगे. मल्टीपल प्राइमरी ट्यूमर्स में भी प्रेजेंट एट द इनिशियल डायग्नोसिस. बहुत सारे ट्यूमर हो सकते हैं ऑब्वियसली. Patients who survive 5 years after the diagnosis of the initial tumor have up to 35% chance of developing at least one new primary. So recurring tumor है, बार-बार हो रहा है, ठीक है? The elevated risk for development of the additional primary tumor in these patients has led to the concept of field cancerization. ये सुनने से important topic है. This hypothesis suggests that multiple primary tumors develop independently as a result of years of chronic mucosal exposure to carcinogens such as alcohol, tobacco. यानी बात ये है कि ये पूरी अगर ओरल कैविटी है तो यहाँ भी अल्कोहल एक्सपोज हो रहा है, यहाँ भी एक्सपोज कर रहा है, यहाँ भी इस एक्सपोजर की वजह यहाँ भी एक प्राइमरी ट्यूमर डेवलप हुआ, यहाँ सो देयर आर मल्टीपल प्राइमरी ट्यूमर्स डेवलपिंग. दैट इज नोन एज फील्ड कैंसराइजेशन. यानी there are different fields of cancer formation from different primaries. Okay. Pathogenesis. Squamous cancers of the oropharynx arise through two distinct pathogenic pathways. One involving exposure to the carcinogen, जिसकी मैं बात कर रहा था अभी कि पान, गुटखा, तंबाकू ये सब चीजें, and the other one is related to infection with human papilloma virus. So दो इसकी pathological features हैं which are the main culprit for causing OSCC. And when I say OSCC, what does that mean? OSCC means oral squamous cell carcinoma. Okay. The number one cause is the persistent irritation and inflammation, and number two is the infection with the herpes, human papilloma virus. Sorry. Carcinogen exposure mainly stems from chronic alcohol and tobacco used, chewed tobacco as well, pan gutka. In India, there you go, suniye, and Southeast Asia, chewing of betel quid, pan, are important predisposing factor. इसमें इन्होंने गुटखा, मावा इस सब का ज़्यादा जिक्र नहीं किया, इन कुछ तरह से नाम पता भी नहीं होंगे, but we know that we have great consumption of these bad things in our country. Now, it is likely that these tumors arise by a pathway similar to that characterized for tobacco use associated with tumors in the West. However, because consumption इतनी ज़्यादा है और directly oral cavity में लोग दबा के रखते हैं, वो एक चीज़ होती है, पाकिस्तान का एक सूबा है KP, वहाँ बहुत ज़्यादा यूज़ की जाती है, particularly नस्वार. That is also containing a lot of chewed tobacco. उसको बाकायदा दांतों और चीक के बीच में ऐसा एक चीज बना के पाउडर फॉर्म में होता है, उसको रख दिया जाता है, बहुत बहुत देर तक वो दांत में पड़ा रहता है. तो सोचे ना कि यहाँ जो चीक है उस पर कितना क्रॉनिक एक्सपोजर है, बार बार इस पर एक्सपोज हो रहा है, तो देयर आर मोर चांसेस ऑफ इन्फ्लेमेशन एंड देन कैंसर फॉर्मेशन और म्यूटेशन होता है सेल्स का. एंड particularly for example tumor suppressor जो जीन्स हैं Chp15 for example वो म्यूटेट हो जाती है, तो इस तरह के लीजन्स बनना शुरू हो जाते हैं ओरल कैविटी में. ठीक है, RAS pathway इन्वॉल्व होता है. Human papilloma virus is another important cause for causing these cancers, and there are some high risk serotypes of the virus. ये virus basically कई सारे flavors में आता है, and the high risk category is for example the human papilloma virus 16. That is considered as a high risk, so it is associated with cancer formation, and it has to be always remembered. Exam में ये बहुत पूछते हैं. It is conservatively predicted that the incidence of HPV associated oropharyngeal squamous cell carcinoma will surpass that of the cervical cancer. So I mean it actually has surpassed in some countries because HPV infection भी बहुत ज़्यादा common होता जा रहा है और tobacco use बहुत ज़्यादा बढ़ता जा रहा है in certain countries. The incidence of oral cavity squamous cell carcinoma has been on the rise in individuals younger than 40 because of the tobacco consumption. The pathogenesis in this group of patients who are non-smokers and are not infected with HPV is actually unknown. Ask me. I mean, हमारी countries में तो I know this is pan, gutka, tobacco and all these sort of things. Okay. Now the next thing that I have to talk about is basically not the odonge. इससे पहले एक चीज थी यार. Where is it? There you go. Diseases of the salivary glands. So obviously as part of the oral cavity we also talk about the salivary glands, and we know that there are three main salivary glands: parotid gland, submandibular and sublingual, as well as there are some innumerable minor salivary glands. Major तो ये तीन हैं. इनकी कुछ diseases हैं which are common. For example, xerostomia. It is defined as dry mouth. I mean, there are some individuals who cannot make appropriate amounts of saliva. उनके salivary gland appropriate amount में नहीं produce करते saliva. They have decrease in production of saliva. Its incidence varies amongst population, but has been reported in more than 20% of the individual older than 70. So that has to do something with age. It is also a major feature in some of the autoimmune disorders such as Sjogren disease है, उसमें dry eyes होती हैं, dry mouth होता है. So it is considered कि कुछ auto antibodies हैं जो glands के structure को damage करती हैं. A lack of salivary secretion is also a major complication of radiation therapy. अगर cancer patient है उसमें radiation therapy है, so it can also lead to xerostomia. However, xerostomia is most frequently observed as a side effect of many common class of medications such as anticholinergic, antidepressants, antipsychotics. ये समझ में आता है because they interfere with the autonomic nervous system, and for that you have to understand the autonomic nerve supply. If that is disturbed, then you have less production of salivary gland product, which is the saliva. Complications of xerostomia include increased rate of dental carie, candidiasis, difficulty in swallowing, speaking. आपको अंदाजा होगा आपकी saliva कितनी जरूरी है. नेचर ने ये जो lubricating liquid रखा है ना मुंह में, ये ना हो तो पता लगेगा, ये सारे problems हो जाते हैं. Then there is a disease called sialaginitis. Now, inflammation of the salivary gland is known as sialaginitis. Itis is always inflammation. It may be because of trauma, viral infection, bacterial infection. A common viral infection जो अक्सर आप लोगों ने सुना भी होता है is mumps, which affect the salivary glands, और उससे interstitial inflammation and the parotid gland is all affected. Mucocele is the most common inflammatory lesion of the salivary gland, results in either blockage or rupture of the salivary gland duct. Gland है, उसकी duct निकल रही है, वो बंद हो गया, so that is called mucocele. Simple thing है यार. Bacterial sialaginitis is also reported because of staph and strep infection, and they can actually also lead to stone-like structure formation because of the stuffed and solid and consolidated exudate formation. So that is considered as stone in the salivary gland, called sialolithiasis. जैसे cholelithiasis होता है, ऐसे sialolithiasis. These stones and infection are also seen to be common in some autoimmune diseases. Again, Sjogren's syndrome is an example. Now, salivary gland also have tumors, and these tumors are actually not very uncommon. They are pretty common, particularly in some parts of the world. कुछ countries में कुछ tumors common होते हैं. So, despite their relatively simple morphology, the salivary glands give rise to 30 histological distinct tumor types. सुने जरा नंबर, इतने सारे तरह के ट्यूमर हो सकते हैं salivary glands में. A small number of these neoplasms account for more than 90%. Obviously 30 हो सकते हैं, लेकिन ये सारे आपको याद नहीं रखने, so tension नहीं लेनी. Overall, salivary gland tumors are relatively uncommon and represent in their country and represent less than 2% of all human tumors. Approximately 65 to 80% arise within parotid. So parotid is the main culprit. Okay, 10% in submandibular, that's the number 2, and then the other tumors. Approximately 15 to 30% of tumors in the parotid glands are malignant. By contrast, 40% of submandibular and 50% of the minor salivary glands and 70 to 90% of the sublingual are cancerous. Okay, so ये percentages याद रखना कोई इतना, I would say this is not an important thing. बट ये इनके डिफरेंट कैटेगरीज आपको पता होनी चाहिए. बिनाइन ट्यूमर्स के नाम, मैलिग्नेंट ट्यूमर्स के नाम. द मोस्ट कॉमन मैलिग्नेंट ट्यूमर इज द म्यूकोएपिडर्मोइड कार्सिनोमा. द मोस्ट अफेक्टेड ग्लैंड इज द पैरोटिड ग्लैंड. ओके, द मोस्ट कॉमन बिनाइन ट्यूमर इज द प्लेयोमॉर्फिक एडिनोमा. सो नाम आपको पता होने चाहिए. बेसिकली ये नहीं हो कि आपको यही ना पता हो कि मैलिग्नेंट कौन है, बिनाइन कौन है, और ये याद रखना आसान भी है. अगर म्यूकोएपिडर्मोइड कार्सिनोमा में वर्ड कार्सिनोमा आ रहा है, एसिनिक सेल कार्सिनोमा में वर्ड कार्सिनोमा आ रहा है, एडिनो कार्सिनोमा में वर्ड कार्सिनोमा आ रहा है, एडिनोइड सिस्टिक कार्सिनोमा में वर्ड कार्सिनोमा आ रहा है, सिर्फ ये मिक्स ट्यूमर है बट इस पे भी वर्ड मैलिग्नेंट आ रहा है. सो आपको नाम से पता चल जाना चाहिए विच वन इज मैलिग्नेंट एंड विच वन इज नॉट. ओके, नाउ दे हैव आई थिंक कमेंटेड अपॉन सम ऑफ देम. Pleomorphic adenoma, it's important because it's the most common, 50% of all the benign tumors. Pleomorphic adenomas are benign tumors that consist of mixture of ductal, yani epithelial cells, and myoepithelial cells. So they exhibit both epithelial component as well as the mesenchymal component. Epithelial elements are dispersed throughout the matrix, which may contain variable mixture of myxoid, hyaline, cartilaginous structures and all these. It's not important for you to remember actually. Mixed tumor है ये. It's like mixed tumor because इसमें different components of mesenchymal and epithelial tissue है. That's what you need to remember. Pleomorphic adenomas represent about 60% of the tumors in the parotid. So parotid, okay, are less common in the submandibular and other glands. They present slow-growing, painless, mobile, discrete masses, typical benign tumor. They recur if incompletely excised. Surgery is the treatment, और अगर सही से सर्जरी नहीं की है तो दोबारा हो जाते हैं. Recurrence rates approach 25% after simple inoculation of the tumor. So इतना ज़्यादा recurrence है, they come back again to say hello to you. Carcinoma arising in pleomorphic adenoma is referred to variously as carcinoma ex pleomorphic adenoma or malignant mixed tumor. ये जो यहाँ एक कैटेगरी हम देख रहे थे malignant mixed tumor की, that actually is the malignant conversion of the pleomorphic adenoma. So अगर pleomorphic adenoma malignant हो जाए, then it is called malignant mixed tumor. Okay? Then the mucoepidermoid carcinoma. तो इन्होंने क्या किया है कि दोनों benign और malignant में से जो most common है उसके बारे में थोड़ी explanation दी है. Now the mucoepidermoid carcinoma is the most common malignant tumor, and they are composed of variable mixture of squamous, mucus-secreting intermediate cells. These neoplasms represent about 15% of all the salivary gland tumors, and while they occur mainly in the parotid, so parotid is the main one, guys, they account for a large fraction of salivary gland neoplasms. Overall, mucoepidermoid carcinoma is the most common form of primary malignant tumor of salivary gland. We know this. Clinical course and prognosis actually depends upon which histological variant is. If it's low grade, it's good. Prognosis will be better. If it's high grade, obviously it will be difficult to excise and it's going to be a difficult tumor. So, or इसमें metastasis हो सकता है. That's simple thing. 5-year survival rate is only 50%, which tells you that this is pretty much fatal tumor. It's not something good to have. I mean, let me tell you, it's not something good to have. Even oral cancer की हम बात कर रहे थे, तो oral cancer का जो prognosis है, it is now improving because of the treatments available, surgery and chemo and radio. So the prognosis is good for oral cancer. But salivary gland tumors, so 50% 5-year survival, यानी 5 साल में patient के जिंदा बचने के chance सिर्फ 50% है. Okay. Now, last bit of today's video is the odontogenic cyst and tumors. Odontogenic cysts usually are derived from remnants of the odontogenic epithelium present within the jaws. इसके लिए आपको पता होना चाहिए कि odontogenic epithelium क्या बला है. In contrast to the rest of the skeleton, epithelium-lined cysts are quite common in the jaws. These cysts are subclassified either as inflammatory or developmental. Only the most common lesions are considered here. For example, dentigerous cyst originates around the crown of an unerupted tooth and is thought to be the result of degeneration of the dental follicle. So just remember what it is. Basically, these are cyst formation within the, dental material and associated structures. And sometimes there are some tumors which develop in these areas. So first one of them is, for example, dentigerous cyst. So dentigerous cyst, and then we have odontogenic keratocyst. Can occur at any age, but they are most frequent in individuals between 10 to 40 years of age. They have a male predominance and typically are located in the posterior mandible. Differentiation of the odontogenic keratocyst from other odontogenic cysts is important because it is locally aggressive and has a high recurrence rate. On histologic examination, the cyst lining consists of a thin layer of parakeratinized or orthokeratinized stratified squamous epithelium. This is how you identify this. With a prominent basal cell layer and corrugated, boring stuff here. In contrast with the developmental cyst just described, ये दोनों cysts जो हैं, dentigerous cyst as well as the odontogenic cyst, they are both called developmental. Okay, now we are talking about inflammatory etiology वाले cyst, यानी इसका ताल्लुक developmental embryology के साथ. ना periapical cyst की बात करते हैं जिसमें inflammation है. These extremely common lesions occur at the tooth apex as a result of long standing pulpitis. So apex पर there is a lot of pulpitis, inflammation खत्म नहीं हुई तो ये cyst इस तरह की बन सकती है. Now, inflammation का general principle है when there is long standing inflammation, cyst formation can be an outcome. Pancreas में ऐसे होता है. Pancreas में we get pseudocyst because of long, pending inflammation. Pseudocyst बन जाती है across the pancreas. Necrosis of the pulpal tissue and यार ये सब important नहीं है. बस इतना याद रहे कि periapical cyst inflammation pulpitis की वजह से बनती है. It's very common. Then the tumors. Odontogenic tumors are a complex group of lesions with diverse histological appearances and clinical behaviors. Some are true neoplasms, either benign or malignant, while others are thought to be hematomas, which is again an embryological issue. Odontogenic tumors are derived from odontogenic epithelium. और उसकी दो जो मोस्ट कॉमन टाइप्स इनके नाम आपको पता होने चाहिए. दे आर एमेलोब्लास्टोमा एंड ओडोंटोमा. Ameloblastoma arise from the odontogenic epithelium. They are typically cystic, hollow होते हैं, slow growing, and despite being locally invasive, they have an indolent course. इतने ज़्यादा aggressive नहीं है. The cysts are lined by palisading columnar epithelium and overlying loose stroma with the stellate cells. जबकि जो odontoma है, the most common type of odontogenic tumor arise from the epithelium, but shows extensive deposition of enamel and dentin. They are cured by local excision. ये जो लास्ट टॉपिक है ना, इट्स प्रीटी ड्राई एंड बोरिंग. इसमें आपको मोटी मोटी जो बात याद रखनी है वो सिर्फ इतनी कि ये जो ओडोंटोजेनिक ट्यूमर्स हैं, these are and the cyst as well, they can either be because of developmental issue, inflammatory issue or because of the tumor. कौन से ट्यूमर्स के दो नाम आपको याद रखने हैं, वो सिर्फ दो नाम पता हो तो काफ़ी है, ओडोंटोमा एंड एमिलोब्लास्टोमा. एंड कौन कौन सी डेवलपमेंटल सिस्ट्स हैं, कौन सी इन्फ्लेमेटरी सिस्ट है. सो यहाँ पे आपको सिर्फ जस्ट द नोमेनक्लेचर. ओके, इसकी समरी देख लें. द जॉज आर अ कॉमन साइट ऑफ एपिथेलियम लाइन सिस्ट फॉर्मेशन. Derived from the odontogenic remnants, embryological issue. The odontogenic keratocyst locally aggressive होती है. The periapical cyst is inflammatory, and the most common odontogenic tumor are ameloblastoma and odontoma. So read this superficially because there are no details in the book. दी भी नहीं उन्होंने, हैवी ड्राई टॉपिक, तो नाम वाम याद रहे तो बस उतना भी काफी. एग्जाम में इस पे इतना फोकस होता भी नहीं है. अगली वीडियो में मैं स्टार्ट करूंगा इसोफेगस. तब तक के लिए अपना ख्याल रखिएगा. टेक केयर ऑफ योरसेल्फ.